I'm here at ASH, and I've been attending and presenting with the latest kind of developments with gene-engineered T-cell therapies for patients with relapsed refractory B-cell malignancies. One of my clinical specialties or focuses is on the toxicities that are generated from this novel technology. The two biggest toxicities that we worry about right now are the cytokine release syndrome as well as the neurologic toxicity. The biggest developments that have occurred so far within the relapsed refractory diffuse large B-cell lymphoma setting is the fact that we now have some real-world experience with commercially approved CAR T-cell products for these patients. And so there's a lot of concern considering that these things were approved by the FDA from a very small clinical trial of 101 patients in a phase 2 trial. So the good news is that the toxicity rates, the outcome rates are very, very similar so far with what's been reported as part of the clinical trial with over 200, 300 commercially treated patients. So that's exciting. And in terms of the toxicity news, there's even a little better news in the fact that the severe CRS or cytokine release syndrome toxicities appear to actually be lower in the real world setting than in the clinical setting. It's not necessarily that the technology or the therapy has become safer, it's that our management of the toxicities has become refined over the last several years. So that's very good news. In terms of the neurologic toxicity rates, they appear to be similar, and right now are probably the most difficult thing that we're managing in the hospital.